Kung nahihirapan ka, ang sarap sa pakiramdam pag may nag-aalaga sa'yo, no? Iba-iba man ang paraan nila, lahat nakakagaan ng loob. Yung alagang magpapakalma sa'yo sa mga oras na ikay natutuliro. Pag masama ang pakiramdam, may mag-aasikaso sa lagnat mo. May magpapagaan ng loob mo sa mga pagkukunoring alam mo pa, kahit hindi na. Then everything just feels better.
There are 3 medications that were stated in the case scenario. First, nifedipine. This was ordered by the physician because Mr. W's blood pressure was 150/100. Second, paracetamol. Upon checking Mr. W, he had a warm skin when touched, and so paracetamol was given after doctor's order was made. Lastly, donepezil is indicated for the symptomatic treatment of Alzheimer's disease.
Generic name, nifedipine. Brand name, Adalat, Adipine, Coracten, Fortipine, Nifedipres. Dosage, 5 mg. Frequency, single dose. Route, sublingual. Pharmacology class, calcium channel blockers. Therapeutic class, antihypertensives. Mechanism of action, thought to inhibit calcium ion influx across cardiac and smooth muscle cells, decreasing contractility and oxygen demand. Drug may also dilate coronary arteries and arterioles. Nifedipine is used to lower hypertension or high blood pressure, wherein it was ordered because the patient had a BP of 150/100. Contraindication. This drug is not contraindicated to Mr. W. The patient has experienced no negative effects, although continued monitoring is necessary. Common nifedipine side effects may include mild dizziness, flushing, warm redness or tingly feeling, weakness, headache, mood changes, heartburn, nausea, tremors, muscle cramps, or cough, wheezing, sore throat, and stuffy nose. Nursing responsibilities. Continue monitoring the patient while taking medication. Monitor patient carefully while drug is being adjusted to therapeutic dose. Do not exceed 30 mg per dose increases. Ensure that patients do not chew or divide sustained-release tablets. If the following side effects are observed, these are the possible nursing responsibilities. If the patient is nauseous, advise to eat frequent small meals. If the patient experiences dizziness, encourage to avoid driving and operating dangerous machinery, and advise to take special precautions to avoid falling. If the patient experiences headache, administer prescribed analgesics as required and indicated. Also, adjust lighting, noise, and temperature.
Generic name, paracetamol. Brand name, Panadol, Calpol, Tylenol, Alfedon. Dosage, 500, oral. Pharmacology class, paraaminiferal derivatives. Therapeutic class, antipyretic drugs. Mechanism of action, reduces fever by acting directly on the hypothalamic heat-regulating center to cause vasodilation and sweating, which helps dissipate heat. It is used to treat fever or to decrease elevated temperature that the patient experiences. Contraindication, this drug is not contraindicated to Mr. W. The patient has experienced no negative effects, although continued monitoring is necessary. Common paracetamol side effects may include nausea, vomiting, constipation, dizziness, allergies, low blood pressure, blood disorders such as thrombocytopenia, leukopenia. For the nursing responsibilities, assess patient's vital signs for baseline data, advise the patient to not exceed recommended dosage, assess for patient's allergies and conditions contraindicated with the drug such as rash or urticaria, and if this occurs, drug may have to be discontinued and inform the physician right away. And lastly, assess the patient's fever or pain, type of pain, location, intensity, duration, and temperature.
Another drug that Mr. W needs to take is the donepezil, or Aricept, Namzuric, Adlarity in brand names. Mr. W needs to take this drug in 10 mg OD or once daily, and it is taken via oral route. Its pharmacologic class is acetylcholinesterase inhibitor, and this drug's therapeutic class is anti-Alzheimer's drug. Donepezil binds reversibly to acetylcholinesterase and inhibits the hydrolysis of acetylcholine, thus increasing the availability of acetylcholine at the synapses, enhancing cholinergic transmission. This drug is indicated to the patient because this drug is used as a treatment of dementia of the Alzheimer's type. It is used for moderate to severe Alzheimer's disease. In addition to this is that donepezil is not contraindicated to Mr. W. The patient has experienced no negative side effects, although continued monitoring is necessary. Possible side effects are as follows: nausea, vomiting, diarrhea, loss of appetite or weight loss, dizziness, drowsiness, weakness, trouble sleeping, shakiness or tremor, or muscle cramps. Here are some nursing responsibilities that a nurse must know. First is to continue monitoring the patient while taking medication. Monitor patient's condition and vital signs frequently, especially before giving the drug. Monitor the patient's adherence in taking the medicine. If following side effects are observed, monitor closely for signs and symptoms of GI ulceration and bleeding, especially with concurrent use of NSAIDs. Monitor cardiovascular status. Drugs may have vagonotic effect on the heart, causing bradycardia, especially in the presence of conduction abnormalities. Next is exercise caution should be practiced. Fainting episodes related to slowing the heart rate may occur.
Kayo, anong alagang hanap nyo?